The LGBTQ plus community has been hit hard by the COVID-19 crisis. Issues related to healthcare, finances, and social challenges during the pandemic has been stressful, and having a safe space to access resources is key right now. Here to tell us more about these hardships in the LGBTQ plus community and the help available is Communications Director for Equality California, Samuel Garrett-Pate. Thanks for joining us.
Thanks for having me this morning.
Talk about any data that we have on how this pandemic is specifically impacting LGBTQ plus people.
Well, we know that the LGBTQ plus community is more vulnerable to the crisis. So we know that LGBTQ plus people have higher uninsurance rates. We know that there are higher rates of HIV and cancer, two of the comorbidities that make people more vulnerable to the virus if they get it. We also know that LGBTQ plus people are more likely to use tobacco products, which, given the fact that it's an upper respiratory disease, makes it that much more dangerous for LGBTQ plus people. And then we know that LGBTQ plus people are overrepresented in the industries that have been hit hardest. What we don't know is how many LGBTQ plus people have the virus, because the state and the counties are not collecting that data when they're doing the testing. And so whereas with communities of color, especially the Black community, Latino community, we have seen higher fatality rates and higher infection rates. We don't know that information about the LGBTQ plus community. We just know that we're more vulnerable to the crisis.
Now, you talked about healthcare and some of the medical issues faced by this community. Was there already a lack of access for healthcare coverage in the LGBTQ plus community before the pandemic? And can you kind of explain why that is?
Absolutely. So there are two main aspects to that. One is that LGBTQ plus people, the rates of health insurance are just lower. We're more likely to be uninsured. The other issue is that LGBTQ plus people often don't actually seek care, even if they have insurance, because they fear or have experienced discrimination, harassment when seeking care in the past. So especially among transgender people, because they face so much discrimination, harassment, or even just lack of acceptance within accessing any type of service, including healthcare services, they actually don't seek care. And we know that that can be incredibly dangerous with a virus that is as dangerous as COVID-19.
Now, we know that our older adults, senior citizens, they're at high risk for coronavirus. Has this further impacted LGBTQ plus elders? And what's it like when we talk about isolation? Is it hard for them to get some of the help that they need right now?
Of course. I think similar to folks not seeking health care when they are sick because they fear discrimination and harassment, a lot of LGBTQ plus seniors spent many years in the closet, then came out and have often even gone back into the closet now because they face such lack of acceptance either in a nursing home or a senior facility. And so they don't seek out services or opportunities for connection if they don't know that those services are going to be LGBTQ plus friendly. So all of these reasons that we've talked about this morning are why Equality California launched a COVID-19 LGBTQ plus help center. It's an online help center that whether it's a senior looking for food services or just connection in order to not feel so isolated, or it's someone who's recently lost a job and looking to file for unemployment insurance. We've compiled all of the resources available to folks into this website. It's covid19.eqca.org, and it's something we're really proud of.
You know, Equality California, like you said, they launched this online help center. How necessary is this? Tell us more about how vital this is for the community.
Well, a lot of people have been impacted by this crisis and are confronting the social safety net that's available for the very first time. Many people haven't ever applied for unemployment insurance before, or have never needed to rely on a food bank or, access any other type of service to give them the support they need right now during this really trying time. And so they don't know where to start, but they do know Equality California because we've been around for 20 years serving the LGBTQ plus community. And so we felt it was really important that we compile all of the resources available, both the ones available from the government and also ones from other LGBTQ plus nonprofits. A lot of LGBTQ plus people have faced discrimination from the government as well and are not necessarily as trusting of those resources. And so what we want to say is, we are the trusted messenger to the community. We've compiled the resources. We want to help people access the support that they need. Again, whether that's just finding a place to get tested for COVID-19 or finding resources for an LGBTQ plus student who's all of a sudden at home without access to their friend network, or maybe even in an unwelcoming or even unsafe environment at home. We have LGBTQ plus youth who are not accepted by their families, for whom school is really a lifeline for them, right? They might have a supportive teacher or friend in class who's really that lifeline. Our help center has resources for those students as well.
Garrett, it sounds like a really great resource for those that need it. What can we do to better support our LGBTQ plus community?
I think reach out to folks. If it's what we're telling everyone, whether you're LGBTQ plus or not. But knowing that the LGBTQ plus community has been hit so hard, if you have an LGBTQ plus friend or family member, neighbor, check in on them. Reach out by text or email. And if you know someone who's struggling, absolutely, please do share this resource with them. Like I said, it's covid19.eqca.org. We also have a helpline that people can call, which is 323-448-0126. We're here to help.
All right, Garrett from Equality California, thank you so much for joining us. It's a great resource that you mentioned. We appreciate you.
This interview involves commercial content. The products and services featured appear as paid advertising.